Welcome to the Global Development Hub's new webinar series, SDG of the Month, where we explore the exciting contributions Imperial's staff, alumni, and global partners are making towards achieving the UN's Sustainable Development Agenda. This month, we are exploring Goal 10, Reducing Inequalities, with a focus on the digital divide, and are delighted to welcome our panel of speakers from UNICEF, the Good Things Foundation, Imperial's Business School, and School of Public Health. We will now pass over to the chair of this event, Professor Tommaso Valletti.
So as an economist, I see this as part of a wider topic of inequality. And economists have been showing how inequalities differ on according to the way you put the data together. So global inequalities, by global inequalities, I mean, if you do cross-country comparison, probably have narrowed because some poorer countries have been catching up. But if you look at within country inequality, so UK only, US only, European countries only, this has been increasing over the past 25 to 30 years. So within country inequality are going up. And for people on the wrong side of the digital divide, obviously the disadvantages associated with being unable to access digital technologies, IT in general, have become more pronounced. So unless digital exclusion is taken seriously as a part of the wider task, a more difficult task to reduce inequalities, millions of the poorest people in the UK will suffer consequences. So the obvious case is education. So kids who lost almost a year of education at school because it couldn't be followed by parents that didn't have access to the right technologies, or there had to be choices made between having a better connection for the Wi-Fi or food, which is something that actually does happen for some families. If we don't take those issues into consideration, the long-term consequences of widening the gaps are going to increase. For instance, and I'm mentioning some statistics from the ONS for the UK. So if you're rich enough, so if you're above £50,000 a year in a household, basically everybody has home internet. Okay? So above 50,000 per year per household, 45,000, then there is access to a fairly decent connectivity. However, if you are below 10,000, so and there are families with that kind of income, only 1 in 2, so 50% is the amount of people that would have access to connectivity, and this is a gigantic issue. So we're going to discuss about it. So I'll start the discussion by presenting this is also an opportunity to show how Imperial is such a diverse community of people doing research in different fields, but we are also we have some commonalities we may use different tools, different research methods, but inequality and health inequalities is something which is at the core of what we do at Imperial. So I'll start off with a few words on my research. And then I would encourage also to have a panelist to present what they're doing. And any questions in the chat, please, once we're done with the first round of presentations, which will take about 20 minutes, then I would like to open the floor. So if you have questions, you can start typing them. You can also read them if you want yourself. We want to make it as interactive as possible. So in terms of my research, as I said earlier, I'm an economist. I've been doing several projects which are data-driven. So I've worked, for instance, with Ofcom, which is the Office of Communications. We've been following broadband development in this country from the early 2000s until now. So it was the first generation of broadband technology, the newer generation, fiber, mobile. And we wanted to see, first of all, what happened to economic development as those technologies were arriving in certain areas. So I set a project there. And then we were also looking, so this was something that the telecoms regulator was interested because the supply side is important. If you want to reduce the digital divide, you need to make sure that prices are not that expensive, but at the same time, you want to give some incentives for the rollout itself. So you have to mediate a tension between cheap prices and incentives to invest. And that was an interesting topic, which I developed at first. And then once you understand who were those that were recipients of technologies, I started looking at the behavior of people affected by digital technologies supplied by broadband platforms, so broadband internet. And it's been an extraordinarily interesting period because it was almost nothing 20 years ago. And then you have a country which has reached almost saturation levels in densely populated areas, but not in rural areas. And this change in the data can be used, hopefully, to highlight some of the economic questions that we were after. So by looking at how people would respond with and without broadband, because there were, I don't know, accidents or because of bad weather in certain areas, we could see those who could have access in a certain period to broadband and who couldn't. The first theme of my research was whether having the internet by having broadband technologies would increase or reduce political participations of citizens. Because in principle, digital technologies, the internet is an incredible source of information. So people, by becoming more informed, they can be more politically active. But the internet is also being a source of entertainment. So there could be leisure time, which is a substitute for other activities. Whereas you would spend in the past time listening to the radio or reading the newspaper, now you are on the internet, on Facebook, talking to your friends. And so we did an important project, in my opinion, that we published in 2019 in the Review of Economic Studies, where we show, and this is a claim of causality, that as the internet arrives and people start using it, overall, this leisure effect prevails. People actually spend more money on the internet, say more time and money on the internet, less money on subscribing to newspapers and other things with higher informative content. So less news outlet, more Facebook in a sense. And the net result is people voting less. So there is a reduction over and above whatever historical trends there may be in the data. There is a reduction in political participation. And there is also a response from the local authorities, because we look at local elections, because then you can have a lot of variation in the data. National elections are rare events in a sense. Instead, the local election is something that gives you more statistical power. And the local authorities respond. So we find that the median voter changes with the internet. It becomes, relatively speaking, more affluent, richer, and older. And therefore, the local authorities cater for the preferences of those guys. So what we find, and now there is a theme of inequality, is that the result is actually driven completely by heterogeneity in consumer types. So what I've just described is not true if you are educated, rich, and old. You know, if you're educated, rich, and old, you were getting your information in several ways, and you still have that kind of information. Instead, those who disengage from politics and political participations are the poorer, the less educated, and the younger. Okay? So we have this, I wouldn't say paradoxical result, this result where the more we reduce the digital gap, the more we widen a political gap. So just bringing technologies as such is not enough. It's not enough if you don't let people know how to use those technologies. And the last example of the research that we have done, and I'll spend 30 seconds on this, is on health choices. Again, you see when people get or don't get the internet, what they do when they have to deliver a baby. So we look at mothers, first-time and second-time mothers, and we see whether by searching on the internet, they are more or less likely to have a C-section. And we see that as they use the internet more, they search for more information, it's more likely they get a C-section. And again, this is a causal result. And this is driven by social demographics. So this is all coming from poor, less educated mothers. And what's interesting there is that from a medical point of view, we don't find any positive impacts in the sense that the health of mother and baby is the same with and without C-section, of those who decide for the C-section, but there is a narrowing of the gap there. So richer, more educated, and wealthier mothers start historically with a lot of C-section. Instead, the poorer people are down. With the internet, trends change, but the gap at the end of the period, thanks to the internet, is actually reduced. So in a sense, it is more choice, which is coming from the mothers who maybe were perceiving they didn't have access to the type of health choices of the richer people, that they use the internet in a different way. So this is more a supply side coming from, I'm sorry, a demand side type of thing. So this is the type of research that we're doing in economics at Imperial College, and which I wanted to share with you. Now I will go to the other panelists. The first in the list is Sophie Coronini-Kronberg. We're very happy to have you. So Sophie is affiliated to us, to Imperial, because she's a honorary senior lecturer in the Department of Primary Care and Public Health. But first and foremost, she's a public health consultant at Chelsea and Westminster NHS Foundation. She's written a lot about inequalities, health inequalities, specifically related to the pandemic. So Sophie, the floor is yours.
Thank you, Tommaso, for that introduction, and also a really interesting backdrop and quite a tough act to follow. So yes, I'm a consultant in public health. I'm aware that not everybody might know what that is. So very briefly, unlike most medical specialties, which look after individual patients and or their families, we take a slightly different view. We look through the telescope from the other end. And in fact, economists might understand it better. It's almost macro and micro medicine. So really, this is macro medicine. And we look at defined populations and communities, and predominantly are looking at how we might improve their health. And 100 years ago, that might be a lot more around the Clean Air Act and sewage in London, which was a real problem. And as time has evolved, some of the things that we focus on have changed. We very much focus on prevention of ill health, and particularly look at the social, cultural, and economic factors that might drive health and well-being. But first and foremost, we are, at least in England, a central part of our mandate, and if you like, our professional code, is about the reduction of health inequalities and health inequities. And COVID is very interesting in that, because although it has it's shone a light on some of the particular issues within England, but they translate to a number of different settings around the world. Actually, I would argue that COVID is a symptom, but it's actually not a cause of inequalities or inequities. I'm talking to you from a hospital in West London. We have a catchment population of about 630,000 people. And even within that catchment, we see huge inequalities, and this was pre-COVID. So for women living in our least deprived areas can expect to live 10 years longer than women living in the most deprived areas. And for men, that extends to 14. And if we look at healthy life expectancy, that extends to 21 or 22 years shorter if you live in a more deprived area. So inequalities are all around us, and this isn't just a COVID thing. But what it has done is it has really focused particularly the public mind around inequalities, and started to really build some of that understanding. Some of the areas that we've been looking at is how, with enforced social distancing measures, we've had lockdowns, not just in this country, but in many countries around the world, and various other restrictions placed on normal or daily life in a very quick and short time frame. So the question was, how can we maintain as much of a clinical service as is possible? And a number of the different reflections and examples I will offer you now are very much from an English perspective, but again, most of these will translate. The first thing to understand is that, I mean, technology, however we define it, whether it's broadband, whether it's even access to a telephone, but actually it is with us, and it has been evolving with us for a long while. And it can have huge positives, and for the majority of the population, it usually does. So it has widened access to a resource for many. So for example, in our trust, we're doing a lot more video and telephone consultations, telephone triage of patients, monitoring of patients digitally, remotely, however that may be done. But I think the first thing to recognize is that not everybody will benefit equally. And that's where the inequity and the inequality comes in. And so I think it's useful to just spend a moment thinking that through. So inequality is if people aren't treated the same. So we might, even if we enabled access to, say, broadband to everybody, and we achieved that, which in itself would be a huge accomplishment, it wouldn't reduce or wouldn't change necessarily inequity. And by inequity, what I mean is, does everybody achieve the same outcome? from that particular, in this case, healthcare journey. And what we see from some of the impacts of digital is, for the vast majority of people, it does work really well. It's more convenient to engage with my healthcare provider. I prefer to have my letters in a digital format. I can keep them on my computer. But actually and it is a minority, but it's a very vulnerable minority, it becomes a real challenge. And it means that their health experience tends to drop. So just going back to English examples, 7% of households in this country remain without internet. And this is in a G7 country. So it is quite important to recognize that there are groups who just won't have access. And it could be out of choice, but it could also be due to other reasons. The other thing that we spent quite a lot of time starting to think through is that even if somebody has access, is it appropriate? So using the example of people in insecure accommodation, so whether it might be that they are roofless, so sleeping on the streets, or they might be in overcrowded accommodation. And we've got about 4 million people in this country in overcrowded or inadequate accommodation, and about 500,000 who are without a home, so roofless. The idea of suddenly having a telephone chat with your physician is a huge challenge because you don't have a safe space to have that conversation. If you look at populations living with, for example, domestic abuse, of which there are about 2 million in this country, the vast majority women, but not exclusively so, and only 1 in 5, so only about 20% say that their online activity is not monitored by the perpetrator. So the idea again that they can have a safe consultation or access in a safe space, the healthcare and the support that they need, is probably something that we haven't recognized. So I think it goes beyond the economic, but it also goes into the social fabric of our particular communities and our societies. Something else is to consider is that 1 in 6 adults in this country has very poor literacy rates. So if we're relying on, for example, written content, which might be delivered digitally, we can't be sure that it can be understood. So I think the average reading age of the population in England is that of a child that's just reached secondary school. So a very, very early teenager. And there will be certain communities where that's a lot lower. People that struggle to engage with digital technology are also, so women we've mentioned before, older adults we've mentioned, but also those with disabilities. And although technology has the potential to transform the experience, the lived experience of people with disabilities, the true reality is that it tends to be very costly and very hard for them to access. And that is true also within the NHS. So I think it's a combination of different factors. I don't think we can say that it's a single driving factor. It's certainly, and if you take them in their totality, they certainly don't make up the majority of a population. But from my perspective, they're an incredibly important, a very vulnerable group that needs support. Obviously, my viewpoint is particularly through the lens of healthcare, but actually that translates into other areas as well. And I think that it's important to remember that, for example, younger people have trouble with affordability of data, particularly. But actually certain people with conditions. So we know that mental health patients are much less likely to be able to afford their data packages, for example. But actually what we're seeing in mental health services is a shift to then their weekly sessions with their therapist being online and as a video call. So those kinds of impacts. So in the interest of time, I will leave it there. I realize it's been a very quick gallop through. Just on as a positive note, I mean, COVID has obviously changed the world. And in many ways, it's been an absolutely tragic roller coaster, and it continues to be, and it probably will be for a while. I think if there is a positive to be drawn out of it, then I would say it is the increased general understanding of inequity and inequality. And hopefully, I would say it's a movement towards social justice and how we might be able to balance out some of these inequities and use this as a really good example of how we might address that amongst some of our most vulnerable communities. Thank you.
Thank you, Sophie. Thank you so much. I'm gonna invite now Sunita. Sunita Grote is an alumna of Imperial College, and now she's a co-founder and manager of the UNICEF Venture Fund. Sunita.
Thanks so much, Tommaso. And yes, it's been a long time since I was last at Imperial, but it's really a pleasure to be here and great to connect back with the community even after all these years. I was in fact in life sciences, and sometimes I look back at that and wonder how I landed where I did, but there is always a connection that can be made. Great to be here today. Today, I'm going to speak a little bit about the work that UNICEF does, focusing on the digital divide. And for those of you who don't know, that UNICEF is the UN's agency leading the focus on children. We work particularly with governments in emerging and developing markets to work closely with them to implement the Convention on the Rights of the Child, the most ratified international treaty in the world, bar one government. And what we do as our team is to help UNICEF explore how frontier technologies in particular could accelerate results for children. And so my team in particular, UNICEF Ventures, is sort of responsible for the very early stage work. We're considered as the people who sort of have to look a little bit into the future and determine which and how technology could be applied to UNICEF's work. And so really the things I'm going to speak about today, and just building a bit on what Sophie was already saying, are not new issues and they're not new work for us, but COVID-19 sort of shed more light on the particular challenges of the digital divide and the importance of digital services. And of course, that has just brought to the forefront the inequalities and inequities that exist in terms of access to these services and these solutions, and has, for us, really highlighted the importance of the approach that we take in terms of how solutions are developed, how they're made available, not just the solutions themselves. So I'll speak a little bit about that today. So first of all, I wanted to share a little bit our experience about the UNICEF Innovation Fund, or Venture Fund, that invests in solutions that we consider digital public goods. And what that's meant for us is that we've really been able to change a little bit the definition of value that digital solutions can bring. On a very practical level, this has meant that we run an early stage fund that takes the principles of venture capital investing and applies them to solutions that we anticipate may accelerate results for children. So some of these solutions include, for instance, using artificial intelligence and data science to predict the spread of epidemics, very kind of acute problem now, and track the impact of social distancing measures on mobility, on access to schools, on access to learning opportunities. Testing how blockchain could, for instance, make cash transfer programs more efficient and effective, or how drones could be used to deliver vaccines to remote areas. All of these are the kinds of pilots and prototypes that our fund has invested in, either internally within UNICEF or investing in startups that come from the kinds of markets that UNICEF works in. Really, what's been key to our investment approach is that we define everything we do, or we exclusively focus on open source solutions. And what that's meant from an investment approach is that we're redefining return on investment based on open source intellectual property. Our LPs, or our donors into the fund, receive and generate value by investing in solutions that increase the amount of open source IP that's available publicly. And so we've changed the definition of investment return and value generation and capture, and have talked about the importance of those processes happening in the interest of the public good. So what this means is not only getting access to the solution itself, but also the recipes behind them. And this allows us to redesign solutions based on the needs of those who need the most. So for instance, think about capturing and using more representative data for algorithms and models that drive machine learning based solutions. And also to increase access to the value generated and captured from the production, adaptation, and scaling of these solutions for countries that are deploying them, and for entrepreneurs and users themselves. What we've seen is that actually that approach can also be mirrored in how we partner with big technology companies. And this has been really interesting over the last couple of years, how we've partnered with big tech companies across the sector, mobile network operators, some of the big tech companies that you'll be familiar with from Silicon Valley, who've joined UNICEF and have actually signed partnership collaborations that any kind of solution that gets generated through the collaboration and partnership is placed on open source licenses and is therefore made available in the public good. We've been extremely pleased to see that this approach has been picked up and is reflected in the recently launched UN Secretary General's Roadmap on Digital Cooperation, where he adopted a definition of digital public goods that is explicitly about open source software, open data, open AI models, open standards, and open content. As we've been doing more and more of this work and investing in more digital solutions, we constantly have come up across the barrier of access to connectivity. We heard about this earlier today in Tommaso's introduction, where really that becomes the fundamental infrastructure barrier to scaling digital access and digital solutions. Half the world's population still remains disconnected from the internet. And what this increasingly means is disconnection from life-saving services. So in 2019, predating COVID-19, UNICEF, together with the ITU, the International Telecommunications Union, launched a project called GIGA, with the aim of connecting every school in the world. And we're now active in 15 focus countries. And GIGA acts as a matchmaker opportunities and connectivity projects for schools in disconnected areas and ultimately their communities. So one of the main levers that GIGA tries to apply to solving this problem of matching adequate financing to the problem of connectivity is technology itself. And we've seen that the lack of transparency and accountability in delivering the kinds of services like connectivity has been a barrier to efficiently making resources work or limited resources work to achieve impact. So one of the tools that we've built is a mapping platform, also a digital public good, that uses, among other things, satellite imagery and machine learning to map school location and connectivity status in real time. So to date, 800,000 schools in 30 countries have been mapped together with their connectivity status. And we've already seen how the power of that kind of real-time data and improved accountability has brought results. In Colombia, for example, machine learning and satellite imagery identified 7,000 unmapped schools. Yes, even the Ministry of Education didn't know about the existence of those schools. And so that, of course, doesn't allow for resources to be allocated, including connectivity, where they might be needed the most. In Kyrgyzstan, by seeing schools on the map, which previously didn't exist, and their connectivity status didn't either, the government was able to renegotiate contract with service providers that were charging the government, but not actually providing ongoing connectivity. All of these tools being fundamental to, again, putting the right information, the right value into the people's hands to control access to connectivity, as well as the power that digital solutions could bring in providing life-saving services. Thank you, Tommaso.
Thank you, Sunita. I'll pass to Joseph, but in the meantime, Sunita, you may want to have a look. There's a question from Simon in the chat for you specifically. You may want to respond directly or later during the Q&As. But now, Joe Chambers.
Yeah, hi everyone. Sorry, I'm just let me cut this off. Yeah, so my name's Joe. I'm from Good Things Foundation. So we're one of the UK's leading digital and social inclusion charities in the UK. So we work with kind of a variety of different organisations, whether that's government departments, private organisations, or other kind of philanthropic kind of arms of different organisations. So we work with them, and in addition, we kind of do all our programs and projects through what we have is the Online Centres Network. So this is a collection of kind of over 4,000 different community organisations. They could range from anything from libraries to refuge centres to schools to job clubs. And by combining these different stakeholders together, we work on numerous different projects that tackle kind of the intersection of digital exclusion, digital and social exclusion that we're talking about today. So for us, our vision is a world where everyone can benefit from digital, and since 2010, we've supported over 3 million people towards kind of achieving different goals within this. And as mentioned before, we do this through lots of different kind of programs and projects. Some ones at the moment include Learn My Way, which is helping people with low or limited digital skills. We also run one called Make It Click, which is helping people kind of develop the necessary digital skills for the workplace, and kind of looking at some of the behavioural and attitudinal components that go behind this. So before COVID hit, much of kind of what we were involved with were these everyday interactions with community partners, working in local spaces, and these could be volunteers or staff members. And what they'd be doing is they'd be providing the digital skills training to people in their community. They had that rich knowledge and understanding of how everything works, different families, different social structures, and they were able to take part through our funding to help deliver different digital skills efforts and different programs. And then COVID hit, and what this meant was that lots of these spaces now had to shut. And so not only were people in these local communities now without these kind of vital spaces in which they can develop their digital skills or help them kind of with their digital inclusion. Maybe these places had the only computer they could access, or they needed someone over their shoulder to help them when they were using the internet. So now with these spaces closed, they'd lost not only the infrastructure, but they'd also lost the support that lots of people need to actually be able to get online. And in addition to this, lots of these spaces were kind of really key community hubs as well, people where by digital inclusion was playing a part in all these kind of different social networks. So for lots of people, you know, it was a really hard period, and I think it still is. And although the community partners kind of often had to shut their face-to-face operations, what they did do was pick up a lot of these efforts by continuing kind of remote support, continuing to reach out into their community and help people where they can. And also they kind of really exemplary organizations able to adapt and help provide kind of where the key issues are in their local area. So as we noted in our Digital Nation UK report in, I think, last year, in the UK, we've also got 9 million people who can't use the internet without help, and there's a 7 million who are unable to access or no internet access at home. But what we're identifying is that kind of through the correct skills and helping support people with their confidence, motivation, and access, in tandem with kind of the infrastructure, tackling data poverty, a kind of an overall strategy, we can move towards an environment where kind of this UK digitally included can start to manifest and the benefits that come with this. During lockdown and during the impact of COVID, we saw kind of two real key groups emerging from this who are being severely impacted. This first group was those who were digitally excluded, but also kind of vulnerable. They might be shielding and they are needing kind of access to that critical support. So these are ones that we were seeing, you know, turning to their local organizations for help and trying to access these vital lifeline services. In addition to this, however, there's a second group, and often these were technically high digitally skilled. They could even be in work, or they were maybe furloughed, maybe from more professional backgrounds or educated. But for them, digital inclusion suddenly became digital exclusion became a sudden reality overnight. They realized maybe they didn't have the digital skills they needed to work from home. They didn't have the kind of the confidence that they could do this work from home as well, the support networks. And in addition, as kind of people mentioned earlier, there was a real kind of lack of personal access, a lack of infrastructure. So, you know, with 1.9 million UK households being without the right internet access and devices, there's real issues there for this digital exclusion gap. Addition, you know, costs, data poverty, a lack of kind of device suitability, or people maybe reliant on smartphones, which isn't fulfilling the needs of whether it's education or health, or whatever needs they are for digital exclusion. We worked with different organizations and our community partners to deliver kind of responses to this. So in addition to kind of co-designing resources for remote delivery, lots of our effort went to a project titled Devices.now, which is now titled Everyone Connected, whereby we've got thousands of devices with data out to individuals, families, communities, and providing them with the support they need to be able to get online during this kind of heightened period whereby digital exclusion and its consequences were really being kind of highlighted. So hopefully that gives kind of a bit of a background of some of the projects there that we've been working on around this kind of digital and social exclusion space. And just some final thoughts are that clearly kind of with COVID-19, it's really highlighted the issue of personal access. So digital exclusion is more than just being offline. People need to have the right devices and the right data to go with these. COVID-19 has unfairly affected many people who are already struggling and digitally excluded. It's kind of put on more and more pressure, or it's compounded problems further. Community partners, local organizations, they can innovate and adapt to crisis with speed, compassion, and intelligence as well. And finally, you know, digital inclusion needs to be a political prioritization, as we've seen kind of in different strategies at the moment, but this must, if this is going forward, it needs to harness these ideas of this local and situated knowledge and really bring in these organizations and understanding that they can understand their communities the best, and they're the ones who can really be targeted to help provide the support needed. Yeah, that's everything from me. Thank you.
Thank you, Joseph. Actually, this is also an important point for me to remind of a couple of initiatives that are happening at Imperial right now. I'm sure there are more. I may not be aware of all of them, but one is called Donate Your Own Devices. So this is Imperial's ICT. It is collecting disused laptops and tablets from the college to individuals in department, etc., in order to donate to school children during the pandemic. And they're collaborating with a charity called Ready Tech Go. And these devices go to children in need in the West London area. Another initiative is STEM education for children around the world, which is where Imperial has teamed up with UNICEF and TWIG. And I'm delighted to have also on this call, on this panel, Dr. Corinne Hanlon. So Corinne, why don't you tell us about that initiative yourself?
Thank you. Thank you for inviting me. Yes, so I'm Corinne Hanlon and I work with the college to manage their partnership with TWIG Education. And TWIG have actually been approached by UNICEF to provide some STEM content for the Learning Passport project. And this is a fantastic example of how the college is currently helping to bridge that digital divide when it comes to education and in particularly STEM. So the Learning Passport, which UNICEF is putting together with a number of partners, including, as I've mentioned, TWIG Education and ourselves, aims to actually provide children with a comprehensive amount of content based on the country's curriculum. It's being deployed by the Ministers for Education, who have been communicating with TWIG, and it's also non-internet dependent. So the whole idea is that we can provide children and their educators with some really high quality educational content that doesn't need to depend on their internet connection.
Thank you, Corinne. Thank you, everybody. So we have another about 20 minutes to go for questions from the audience. There are already quite a few in the chat. I see that Mike has made one directed to Sunita and Joseph, and these are, the question is, what are the highest priority, the highest unknowns for your organizations? That could be answered by research. I mean, at Imperial, we are a research community. So what are the types of gaps in data, knowledge, evidence that you're experiencing in your organizations? I don't know who wants to go first. Joe, Sunita.
Yeah, I can give a. All right. Yeah, I'll go on. So I guess in terms of the highest priorities that we're thinking about, as I noted earlier, I think we're in how we work at Good Things, we're in a fortunate position whereby lots of our interaction is through our our big network, our online centers network. And through this, we're obviously able to get this kind of real-time picture of some of the consequences. For example, through COVID-19, you're able to get this real-time picture about the impacts of an event such as this on digital exclusion. And I'd say through this, one of the key I don't know if I can give it a specific demographic or labeled like that, but one of the key target areas for people who, without access to the necessary digital infrastructure or the support networks that I identified before, people were suffering from this compounding of challenges. So whether it was mental health challenges, and then being digitally excluded, they then had nobody to talk to, nobody with this. It then impacted universal credit applications. It then impacted family structure, and so this compounding of cycles. So often, what we found is one of the key people, and what we often targeted with Everyone Connected and Devices.now, these projects, we use community partners would identify who are the families and people who are facing this real compounding of issues, this cycle of issues that digital exclusion were resulting in. And so I think that's a real critical area to which I think further understanding can go into of how these knock-on effects, especially during events like COVID as well. Yeah, we saw real benefits whereby the devices and the data, they act as somewhat as a circuit breaker, not necessarily saying a device and data can solve every issue that people are facing, but what it does is it helps kind of slow down the scale and impact of some of these really kind of harmful cycles that are going with issues, cause further issues.
Cool. I make an observation. So many of the things we're discussing, obviously, to reduce inequality during the pandemic, there will be the cooperation of several. There's going to be individuals doing things, bottom up. There's going to be governments. There's going to be businesses trying to help. And the research community, people like me, for instance, our job, I think, is, of course, to look at the data, but also to keep asking questions. I'll be more specific. So, and questions so that the solution that we are finding under pressure now don't become counterproductive in the longer run. I'll give an example. Reducing the digital divide has been something which has been a priority in developing countries for many years. And Facebook, there was a question from Emma in the chat, slightly different. I may get to that one, Emma. But Facebook has tried in many countries to launch a product called Free Basics. So where they would say, look, we give a cheap phone, we provide connectivity, we do it ourselves. However, although they didn't publicize it that way, basically that person will be locked in our system because they will be on Facebook. It's going to be very difficult to get outside on Instagram, etc., on WhatsApp, on the ecosystem, which is owned by Facebook. In India, which is a country that was experiencing that problem, decided no thanks. Okay, India was the government response of India was pretty tough, but the same kind of offer, difficult to refuse, was not refused by a lot of African countries. So we are entering a new age of data colonialism, where the poorest, the weakest, because India, is a developing country, but on the rise, and they had a challenge. The policymakers couldn't simply say no, but they decided that the infrastructure can be developed using competition, investments, and some regulatory tools without renouncing to the sovereignty on individuals, especially the most vulnerable one. So here we have to be very careful. It's great that the big tech contribute. It's great that the mobile companies during the pandemic gave data in order to trace how people Vodafone has done amazing work with the research community. But it's important also that people like me put also a hold to say, these guys also want to get political capital, because in the next merger, when they're going to ask the regulator in this country to reduce competition because they want to reduce to have a more consolidated markets, we have to say no. But it will be difficult if they do great things when we are in need of them. So we always have, as academics, at least, to step back. And I know we may sound a bit boring, but that's the biggest role that we have, to keep asking questions so that the most vulnerable one in this period are not going to be exploited even more in the future. And the Australian example, since there was a question by Emma in the chat, those who are not following it, so basically the Australian regulator has asked Google and Facebook to pay money to the newspapers in order to show the news in the news feed in Google or in the Facebook ecosystem. And Facebook did something which is very strong. Facebook decided as a reaction to cut off Australian news for everybody in the world. So from one day to the next, which is where I started from. Our dependence from the big tech is unprecedented. And this is not what I call a resilient system. So this is my risk, that we are going from a level of discussion which is complicated, but at least we have a democratic process of understanding how we reach solutions, to completely bypassing this, where it is only the economic power. By the way, the business model of Facebook and Google is based on advertising. So Emma's question was, is it good in the end? Well, Facebook, what they want is to create engagement, to have you as long as possible on their own properties until they find the right moment with the algorithm to target you with an ad. So is it good, is it bad? Unfortunately, it's not particularly good, because people get engaged not with high quality news. People get engaged with violence, sex, and a lot of things, and Trump and all these things that create engagement. And so I don't think the situation is gonna improve a lot, but it just recognizes this huge asymmetry in bargaining power between news outlets and the big tech. Anyway, that was a point, and I see Sophie has raised her hand.
Yeah, I just wanted to come back on that. I think you make some really good points, and I think it's also worth just taking some of that into the healthcare space. I mean, I think there's some big areas here where if we look at electronic patient records, they have huge opportunity in how we harness data and how we can monitor and manage individual patients, etc. But actually, who owns that data? Where does that go, etc. So I think there are some big questions around that for sure. And how are we going to leverage it to, again, for sort of public benefit, if you like, but there are inherent risks in the system. And as always, we are likely then to disenfranchise a small group. So I think it's both an academic question, I think it's a sort of political activist question, I think it's a general social question of where we want that information to go, who to control it. Just now, because it's in digital format, it's easier to share, it's much harder to retrieve, but it's very valuable. I think that's the thing. You know, big companies wouldn't be investing in this if they didn't see a value, and I think that's definitely something worth exploring.
Definitely, Sophie. There were some questions about microfinancing and digital apps in the financial sector. So in developing countries, in developing countries, there has been a tremendous success of initiatives such as M-Pesa in Kenya, for instance. But this is not an experience, or also in Uganda and in other countries. In Tanzania, in Kenya, and a few other countries, very successful stories. And instead, there have been some disasters in India. Until recently, India, the whole idea was banking the unbanked, but India had a very powerful banking sectors that didn't want to see the entry of non-traditional players, which were the mobile players in that occasion. So India at first, and then things changed since they abandoned it, but at first they decided that to have the ability to do these micropayments, it could be done only for people with a bank account, which was basically, I mean, that was not the purpose, was trying to give access to financial resources to people without a bank account. And so if you oblige, if you give a license only to those who do have a bank account, it defies the purpose. So you have to do it well. And also this is, again, it's interesting. Sorry if I see through the lenses of competition, which is my area, but that's who I am. It's interesting to see how the reaction there was some newcomers, some new entrants. So the non-traditional financial operators, which were the mobile operators who can just transact by sending text messages to each other, then they were seen as a threat to the incumbent in the banking sector. And so the incumbent banking sector came with the idea of financial stability. If you do this, the financial system is going to be not controllable. We can get, and so going to central banks in order to, and we learned how to do it. We did also a ladder of competition, so regulation should be proportional to the services that were done. So we learned a lot. So we did quite good experiences for banking the unbanked, especially in African countries, which are very, very valuable. And the World Bank and other institutions have been working on it. So, but you have to do it well. You have to do it well, otherwise it doesn't work. So I see, let me see, sorry, I wasn't following the chat, apologies. I see Yvette. Yvette would like to discuss what can be done for affordability in the poor countries. Affordability. So 1 month of internet is higher than the salary of a person. So anybody wants to take affordability? Affordability of infrastructure, so access to telecoms, basically. So Yvette, I'll start. One way, obviously, when you talk about affordability, you have to distinguish between broadband and mobile. So broadband is a big problem because broadband fixed networks are in cities, but they are just too expensive to roll out in countries which are over wide areas. That's too costly. Instead, mobile has been a more successful story. So mobile still need infrastructure sales, And so the most important thing is the licensing issues there. So release spectrum. So the biggest reform that is important for the rollout is to make sure there is enough spectrum in African countries or developing countries, and make sure that once again this spectrum is not given only to the incumbents. So create at least 3 operators per country. Less than 3 is not enough. Less than 3, these are converging very soon to duopoly, if not collusive, market structures, and and these market structures support very high prices, which is the opposite. So I would say licensing would be the most important thing. I don't know if I see Yvette is on the call. Maybe you want to say something else.
I'm saying this from my direct experience, because I live in Geneva and I take everything for granted. But when I go home and I have, even for me, somebody of my status, to access the internet, to participate, it becomes extremely expensive, be it even for mobile or for broadband. It is extremely expensive. And, I just think about, if I can find it so difficult to afford it, what about the other people? And when we talk about the digital divide, this is what comes to mind to me, to say that unless we can reach those people whom we're targeting here, I mean, for us, yes, we can have water, but then for the poor people, well, if even we educate them and everything, they will not be able to afford to pay for the services. So I think this is a problem which I know it can be addressed at the national level, but I think it's something we have to push more for in the context of looking at inequalities, because if we do not do it, we can develop very good systems, but what will happen is that some of the people that we want to reach will not be reached, purely because they can't afford it.
Very good. Sally, are there, no, sorry, it's a new one. Sally is asking whether there are opportunities for collaboration to improve digital literacy in African countries. Is anybody available? Is anybody aware of such initiatives?
What kind of collaboration are you looking for? So I think there's the learning passport, for instance, that Corinne talked about, is one initiative that UNICEF is leading, which is around literacy, but through a digital platform that works offline and online. So that's definitely one of those entry points. There's a fair bit of work also being done in the technology space, looking at how to leverage, at least that's work that our team is leading on, how to make learning journeys more personalized. So how can we make sure that the solutions and the content that's being provided is actually meeting the specific needs of a particular learner? So that could be based on their own capacity and their own level of understanding, but also on the particular needs that, for instance, children with disabilities might face. So how do we make sure that interfaces are actually using universal design and that content can be converted into the formats that make content accessible for all children and all young people? On the flip side, also looking at how do we make sure that content actually meets the job markets and the job needs of the current economy? What we're seeing is that most school systems and most content and curricula are still fairly outdated in the sense of preparing sets that will keep young people competitive in the job market over the coming years. So these are all sort of more problem sets, but I think depending on the kinds of engagements and areas of collaboration, there's quite a few initiatives that are operating either at the very local level or more sort of at the global level, trying to bring together academia, technology partners, and others to try and crack these major challenges.
And also a source which may be useful, the World Bank, the World Development Report 2021 is called Data for Better Lives, and it's a lot about digital inclusion. So you may want to look at that source too. So we are coming to an end. There was a question for each one of our speakers that I will ask you. You can choose in the interest of time to answer both or only one. First question, what are you most hopeful about in the context of reducing digital inequalities? So a positive message. And what can we as individuals do in our daily lives to contribute to achieving this goal? So I will start with Sophie.
Oh, thank you. I think I would go back to something I mentioned in my talk. I think there is an opportunity in COVID, and I think if it is, the focus has been on inequalities, particularly in England, where we've seen disproportionate morbidity and mortality amongst, for example, the BAME community. So I think it's an awareness is the positive, and I think there's a wider general understanding. I think now we need to seize that, and that is an individual and a collective responsibility. So for me, that's very much within healthcare, and how we can, if you like, democratize access to healthcare in a country where we actually have a universal healthcare system. But I think in our reaction to COVID, we might be generating, if not exacerbating, health inequalities, and I certainly wouldn't want.
Very good. Sunita.
Thanks. A really good challenge, because I think we spend most of our days looking at the downside and the challenges that we encounter all the time. I think probably one of the most hopeful things, one of the most positive things I've seen is how a lot of the governments and markets that UNICEF works in actually are leading the way on exploring new ways of closing the digital divide, and are not trying to repeat some of the mistakes that we've seen in other markets. And that comes how solutions are being designed, how they're being deployed, but also how connectivity gaps themselves are being closed. And I've seen some of the most forward-thinking and innovative leaders really working within government in markets where otherwise I think our perception can often be that the resources and capacities don't exist in those countries. And so I'm really, it makes me very hopeful to see that. I think we'll see leadership coming from those markets that will actually, over time, overtake some of the more industrialized markets, their approaches of closing the digital divide.
Thank you, Sunita. So, Joe.
Yeah, I think I'll also go for the hopeful one as well. So I think for me, within a UK context, I guess over the last year or so, it's just, I guess from what we're working in Good Things Foundation, it's still understanding that when crises do emerge within kind of digital exclusion, there is that kind of frontline staff and volunteers of different organisations who will always do that kind of utmost to support people who are most affected. And they're the ones that are really able to get that understanding of what a challenge is to someone, and to get that knowledge of kind of where they want to go and how they want to do it. And I think also I think through some of our research, and probably other people on this call as well, it's influenced that kind of, I guess the hopeful element is that we're influencing how government policymakers think about digital skill development. So realizing it's more than just having a simple kind of tick box of skills. It's about having the attitudinal and behavioral components that go with this, such as trust and motivation and confidence and community. So I'm hopeful about that kind of that reframing and rethinking of how we understand and learn about digital skills.
That's great. Thank you, Joe. And it's a sunny day in London, so that's at least a very positive sign. And what can we do next? Well, there is a next event that the Global Development Hub is organizing. So perhaps, Tilda, you can put the last slide again on the screen just to remind our participants of the next event on gender equality. And so that leads me to, this brings to a close. I thank all the participants. It's been a pleasure to host all of you, and I wish you a very nice morning, afternoon, evening, wherever you are. Thank you so much.